Hello, everyone, and welcome to ADO's June webinar. And with June being Scleroderma Awareness Month, we'll be taking an in-depth look at the symptoms, causes, and treatments for this systemic autoimmune disease. Today's speaker, as always, is Clinical Assistant Professor at Georgetown University and ADO's Medical Director, Dr. Howard Zahalsky. Welcome, Dr. Zahalsky, and thank you for joining us today.
Thank you again. So today we're going to be talking about scleroderma. Before we start, I wanted to explain to everybody exactly what scleroderma is. So the word scleroderma comes from two words, sclero, which means hard, and derma, which of course means skin. So scleroderma is actually the hardening of the skin. When you're building a house, and I'm going to take a break from the body for a second and explain, when you're building a house, let's say you're building a brick house. Most of the time nowadays, you don't actually start with the bricks. You make a wooden frame to the house. You may lay some flat plywood over the wooden frame, and then you attach the bricks up against the frame. Your body is kind of built like that as well. The skin overlies a frame of what we call connective tissue, which is underneath the skin, and supplies the structure on which the skin is then laid on top of. Now, again, by skin, I want to explain that we're not strictly just talking about the skin that you see that you put suntan lotion on when you go to the beach. Anywhere your body has a lining is what we would refer to as skin, or the skin for the sake of the argument for scleroderma. Where might you have skin or lining tissue besides for the skin on your body? Well, the inside of your mouth, for instance, the inside of your intestines, the inside even of your bladder. Anywhere that your body has a lining is considered skin for the sake of discussing scleroderma. In scleroderma, your body, for reasons that we don't fully understand, attacks that structure that is underneath the skin, causing an excess of collagen to build up. Now, some of you may say, well, great, more collagen. I just went to the dermatologist and paid $500 for an injection of collagen to make my skin look healthier and plumper and shinier. Well, the collagen that builds up in scleroderma isn't that nice beautification type of collagen. It makes your skin excessively tight and taut and even at times painful. Now, there are several versions of scleroderma, and on the next slide we'll go to the most common type of scleroderma. Here we have Crest syndrome, which is also known as limited cutaneous scleroderma, scleroderma that is mostly attacking just the skin and lining, but not the internal organs as much. There are 5 main parts to Crest syndrome that spell out the crest, C-R-E-S-T. They are calcinosis, which are calcium deposits in the skin, Raynaud's phenomenon, esophageal dysfunction or esophageal dysmotility, in which your esophagus, your throat, doesn't work properly, sclerodactyly, which is specific tightening of the skin of your hands, and finally telangiectasias, which are red marks typically found on your face, although they can be on other parts of the body as well. And let's go into each of those now in a little bit more detail. On the next slide, you'll see an obvious appearance of a calcinosis. Here is someone who has calcium deposits, little white deposits building up underneath the skin. These can be large. They're usually not nearly as painful as they look. They're more just like a big giant white lump underneath the skin. They are frequently found on the hands and in the nail beds, right, where the nail attaches to the rest of the body. And they can eat away at the joints. So although they are not particularly uncomfortable, they can be destructive. They are oftentimes treated by removal. You need to surgically cut them out, but they can reoccur because the underlying problem of the scleroderma is not properly addressed. Here you see the R of the Crest syndrome, or Raynaud's phenomenon. Raynaud's phenomenon is when usually your hands, and usually when they are cold, become very discolored, usually from the tips of the fingers inward. So as you can see on this person's right hand, the distal half, the outer half of their right second finger from kind of their second joint onward is bright white. The other hand has a more mottled, splotchy appearance, but this is also Raynaud's. The discoloration can be bright white like you see here, but can also be blue. A lot of people refer to this as lost circulation, and they're not actually wrong. Everybody has the propensity for Raynaud's, and not everyone with Raynaud's. In fact, most people with Raynaud's do not, in fact, have scleroderma, although it is a key feature of the CREST syndrome. Have you ever wondered why when you go out into the cold, your hands and your feet are the first things to get cold? Well, that's actually because your hands and your feet have some of the best circulation of your body. And when your body goes out into the cold, your body senses that there's a lot of blood flowing to your hands and your feet, and it's losing a lot of heat through your hands and your feet. So your body naturally cuts down on the amount of blood it sends to your hands and your feet. It's a reflex, actually, so that you don't lose as much body heat to protect the internal organs. In people with Raynaud's, that reflex is overactive. As a result, they will lose too much circulation to their hands and their feet to the point their hands turn blue or white, and it will look, and it is in fact, that you're not getting enough circulation to your hands and your feet. However, despite that, it's not actually dangerous. Your body will not, even in Raynaud's syndrome, even in scleroderma, cut back so much on the circulation that you do permanent damage to your hands. And when you go back inside or you put your hands in some nice warm heated gloves, the color will quickly return to your hands. So the E of CREST syndrome is slowing of the esophagus, or esophageal dysfunction, or esophageal dysmotility. Again, I said that anywhere that there are lining cells can be affected by scleroderma. So there are lining cells on the inner side of your throat. And what can happen is the collagen can build up on the substructure, the structure underneath that lining of your throat, and prevent the esophagus from doing its job. The esophagus is supposed to slowly guide food from your mouth when you swallow it into your stomach. But if there's too much collagen buildup, then the walls of the esophagus get too stiff, and the muscles of your throat, your esophagus, can't squeeze properly and move that food down. So what symptoms do you get? Well, the first thing you get is you'll notice that it's becoming harder to swallow food. You may swallow a part of a hamburger or a piece of chicken and notice that it seems to be getting caught on the way down. That you might have to wash it down with a little bit of water in order to get it all the way down. The other thing that happens is that acid, which normally sits in the stomach, it's easier to creep out of the stomach and move upwards. That downward squeezing of the esophagus, one of its main purposes is to keep the acid in the stomach and not from coming back up into your throat or into your mouth. So you may develop a bad acid taste in your mouth, or you may develop painful reflux or heartburn as a result of esophageal dysmotility. Conveniently enough, this month is also Reflux Awareness Month. So with scleroderma and esophageal dysmotility, we're actually hitting 2 awareness months at one time. All right, let's go on to the S of CREST, which is sclerodactyly. One of scleroderma's most obvious features is skin tightening, particularly of the hand. And what you have here is someone whose hand skin has gotten so tight that they can't even fully relax their finger anymore. And it starts to tighten and it starts to deform. Sometimes, with enough skin tightening for enough time, that can actually start to do permanent damage to the joints. And sometimes this has to be treated by surgical release, where you actually go and you cut away at some of the connective tissue underneath the skin to loosen up the tendons to relax some of those fingers. The final part of CREST syndrome we'll see on the next slide are telangiectasias. Here what you see is a gentleman who has red spots all over his face. What are those red spots? It's not actually a rash. As the blood vessels move through your skin, they're actually moving through that substructure, that support layer underneath your skin. When you get too much collagen buildup, it becomes like a traffic jam. It's like someone setting up construction cones right in the middle of the road. So the blood vessels get partially blocked, and it causes, again, a traffic jam, a pooling of blood in certain areas. Those little blood pools where the blood is having a hard time finding its way through the traffic cones are these telangiectasias, little pockets of blood underneath the skin that the blood is just getting trapped in. They're not dangerous at all. They usually don't itch or hurt, but they can be uncomfortable. They can be unpleasant to look at, and people just don't like their appearance very much. So those are the 5 key elements of CREST syndrome, and people with the CREST syndrome or limited cutaneous scleroderma usually don't have any life-threatening complications from their scleroderma. Sure, they can have some joint problems, and sure, they can have some problems with reflux, but usually they have a normal length of life. And we'll see later on the more serious forms of scleroderma that that isn't always, unfortunately, the case. But first, we're going to go on to a less common but even milder version of scleroderma, which is called Scleroderma morphea. In Scleroderma morphea, all you get is some local skin areas of particularly tight skin. Again, people might say, well, I actually go to the dermatologist specifically to have skin tightened in certain areas. Unfortunately, you don't get to pick and choose with scleroderma which areas get tightened. And a typical appearance of morphea is on this slide, where you see individual circles of tight skin caused by Scleroderma morphea. There's a lot of things that can have this appearance, so it often takes a biopsy of areas like this to figure out that it is actually Scleroderma. Now, a still less serious form of scleroderma compared to diffuse scleroderma, but more serious than morphea, is diffuse cutaneous scleroderma. In diffuse cutaneous scleroderma, you can affect and get tightening and hardening of the skin everywhere on your body. Now, at first glance, you might look at this woman and say, there's something that looks a little funny about her, but I can't quite figure out what it is. And I think the first thing most people would notice are the teeth. She just seems to have disproportionately big teeth. It's actually not her teeth that are the problem, it's her skin. All of the skin of her face is tightening and pulling back. And as a result, she doesn't have much in the way of wrinkles on her forehead or around her eyes, and her eyes are actually prominent. But the skin, even around her lower face, is being pulled back also, thinning out her lips and making her teeth prominent and exposed. It kind of has the look of someone who had a bad facelift, except you're having this all over your body. While she's having this on her face, she may also be having some sclerodactyly, the tightening of the skin on her fingers, tightening skin on her legs, making it more difficult to walk, tightening skin in her arms, making it more difficult to move and use her arms. And this can be, while not necessarily a life-threatening version of scleroderma, a certainly life-complicating version of scleroderma. But on the next slide, we're going to start to see some of the effects of the more serious version of scleroderma, which is systemic scleroderma. Now, first here we have a normal lung on a CAT scan. I want to explain to you for a second what you're looking at. You're looking at a person as if they were sliced like a loaf of bread, lying down, looking up from their feet. So what you're seeing here, those big black areas with little white streaks through them, those are the lungs, and the white streaks are the blood vessels and the bronchial tubes going through the lungs. But those are some normal, healthy lungs. There seem to be kind of 2 lumps towards the top of the picture. Those are the patient's breasts. And in the middle, very center of the picture, you see what looks like a black circle. That's actually the esophagus, where you swallow food. Around that little black circle, there are 3 white areas. 2 are white circles, and one kind of looks like a white hot dog. Those are actually blood vessels and the chambers of the heart that you're looking at. The heart is in the center and slightly over to the left, and since we're looking up at this person from their feet, the heart is on their left, but slightly on the right side of the picture. But the main thing I want you to focus on are the lungs, which are predominantly black with just some little white stripes where there are blood vessels and breathing tubes going through the lungs. Now, in the next picture, we're going to see what a lung of someone with scleroderma looks like. So here there's two things worth noticing. First, again, let's start with the lungs. You'll notice that they don't look so black anymore. They look more grayish, and certainly towards the bottom of the lungs, which is actually towards the patient's back, what you're seeing is kind of a cotton candy looking discoloration of the lungs. This is because the internal lining cells of the lungs, again, that's a kind of skin as far as scleroderma is concerned, are hardening up, and the word we like to use in medicine is fibrosing. The lungs are tightening, leaving less room for air, and over time, those lung tubes will completely collapse and make it very difficult to breathe. This can be a life-threatening consequence of systemic scleroderma, progressive pulmonary fibrosis, which can often lead to death in patients with diffuse scleroderma, and is what kills most people who die of scleroderma. The other thing worth noticing in this picture is the heart. You can see towards the top of the picture, which is towards the front of the patient, is what appears to be a large, whitish, mottled colored object. That's not a tumor. That's actually the heart. And it's gotten very big, and in this lying down position is kind of squeezing the esophagus that, remember, in the previous picture was a black circle. Here again, it's black, but it's kind of egg-shaped, and it looks like it's getting squished. There's also lining cells on the inside of your heart where the blood flows through your heart. Those can be affected by scleroderma as well. Those can harden, and it can make the heart work less well. And sometimes, because the heart is unable to squeeze like it's supposed to, it just gets stretched out over time and can look big and bulbous like it does in this picture. So those are the main consequences of severe scleroderma. Systemic scleroderma. It can affect your lungs, it can affect your heart, and sometimes it can even affect the kidneys. So medications which block the immune system are often used to treat scleroderma. Scleroderma is considered an autoimmune disease. Your body is attacking itself. Again, it's specifically attacking the foundation on which the skin is built. We don't know the exact antibodies. For some diseases where our bodies are attacking itself, like let's say rheumatoid arthritis, we've been able to identify the exact antibodies. For scleroderma, we have not been able to do so yet. When you're trying to diagnose somebody with scleroderma, we have several tests that we use that look at different antibody levels, including one, the SC70 antibody is specifically sensitive for people with scleroderma, but it's one of several antibodies that tends to be elevated in patients with scleroderma. So in order to treat scleroderma, we try and block all of the antibodies that are involved in the hopes that it will slow the progression of the disease. Once the collagen has been formed, we can't undo it. We don't have any collagen-dissolving medication. So what we try and do is stop it before some of the damage, particularly the lung damage and the heart damage, has been done by using medicines that block the immune system. But as you can guess, these medicines, which have names like cyclosporin and methotrexate, have a lot of side effects. They can affect the liver, and they can block other elements of your immune system and make you more susceptible to other diseases, including such things as tuberculosis. So we don't always want to use them for more limited forms of scleroderma, like the CREST syndrome. So if you think you are having any of the symptoms of scleroderma, if you find your skin is tightening uncomfortably, if you're having more trouble swallowing your food, maybe if you even have Raynaud's syndrome, although again, most people with Raynaud's syndrome do not have scleroderma, then talk to your doctor about possibly getting evaluated for scleroderma, because if you do have the more serious version of scleroderma, finding out early is very, very important. So how can Activ Doctors Online work for you in helping if you have scleroderma or if you're concerned about scleroderma? So Activ Doctors Online has three main solutions that we use to help all of our patients, particularly if you have scleroderma. First of all, with your personal health records, we help you to keep your own personal health records online in a convenient and secure platform. People with scleroderma often end up seeing a lot of doctors. You might have a cardiologist, a pulmonologist, a dermatologist, a rheumatologist, in addition to your regular doctor. And they don't always share records as efficiently as you would like, and that can lead to duplication of tests and procedures and cost. By maintaining all of your records online, and we will help you collect all of those records from your doctor, it makes sure that you have access to all of your records, things don't get duplicated, and that all of the doctors have all of the information when they need it when you show up for your visit. Second, we have our online second medical opinions. Scleroderma is a very complicated disease, and it's not that common. So maybe your local doctor hasn't seen very much of it. Maybe even your rheumatologist is not an expert in it. Activ Doctors Online can put you in touch with our network of specialists, thousands of specialists from around the United States and around the world from some of the top hospitals around the country. We can look at your electronic medical record and give you our advice on what might be the best form of testing or the best form of treatment for your condition from specialists who you may not have had access to in wherever you happen to live. Finally, with our e-consultation feature, if your doctor is a member of Doctors Online, you can have video conferences with your doctor and potentially save you trips to the doctor that might not be necessary. Now with that, I'm going to turn it back over to Tom, who can tell you a little bit more about how to get started using Activ Doctors Online's platform.
Well, thank you, Dr. Zahalsky, for another informative presentation. Here at Activ Doctors Online, our vision is to reinvent healthcare by providing user-friendly mobile health solutions that allow people all over the world to live safer, healthier, and more productive lives. We strive to educate, engage, and empower our members to take control of their health destiny to save time, money, and even lives. We hope you've enjoyed today's presentation, and we invite you to start a free 30-day trial over at activdoctorsonline.com and by clicking Get Started. For more information, to schedule a demo, or if you have any questions about our service, please feel free to contact Activ Doctors Online using the information on screen. We're also available via all the major social media channels. Thank you for watching today, and we look forward to seeing you next month for another health webinar.